It is time now for Morning Rounds with CBS News Chief Medical Correspondent Dr. Jon LaPook and CBS News contributor Dr. Holly Phillips. First up, the World Health Organization convenes an emergency committee meeting on Monday to address the Zika outbreak. The mosquito-borne virus appears to be linked to birth defects in newborns. Health officials warn that as many as 4 million people in the Americas could be infected by the end of the year. This is what everyone's talking about.
Yeah, very much so. You know, there have been more than 30 cases of the Zika virus in the United States, but none of them have been contracted here. They've all been in people who've traveled abroad. Nonetheless, you know, it's being considered a pandemic at this point. It's in South America, in many countries. It's in Central America. It's in the Caribbean. So the big question is, will it come to the United States? And the answer is probably yes. Sooner or later, we will see some local transmission here. But the idea is there won't be a lot. For instance, we saw some dengue virus here, we saw some chikungunya virus here in Florida and in Texas, and these were small outbreaks. The reason we don't expect to see larger outbreaks, there are actually a few reasons. Number one, most of the United States experiences a real winter. Mosquitoes don't tend to like 2 feet of snow. It's just not their preferred environment, and so that helps to control the population and transmission. The other reason is that even when it is warmer, in the United States we use a lot of air conditioning and screens in the windows. That's unlike some of the countries where we're seeing a great deal of spread. So the answer is we probably will see some here, but hopefully not a lot.
Is anything specific being done, John, to prevent this from spreading now?
Yes, and I think, you know, Holly mentioned a few of them. They're getting rid of places where the mosquitoes breed. In Brazil, they're trying to drain the swamps. They're using pesticides. They're telling people to have protective clothing. But I agree with Holly. I spoke to Anthony Fauci, who's the head of Division of Infectious Diseases for the NIH, and he said, yes, it probably will come here, but the odds that there's going to be a widespread outbreak here on the order of Brazil, very unlikely.
But what about those people who've already traveled? I mean, now they have the alerts saying don't go to these areas, especially if you're a pregnant woman. But what if you already went there? Sure.
You know, well, it's better safe than sorry. So the CDC is being very clear. They say if you have traveled to one of the areas where Zika is spreading and is predominant, and you have symptoms, symptoms include fever, joint pain, rash, redness of your eyes within 2 weeks of returning, you should go in and see your doctor. But the other thing is that about 80% of people who contract the Zika virus don't in fact get any symptoms. So if you are pregnant and you've traveled someplace where there is Zika, it makes sense to get into your doctor and just get an ultrasound. Make sure everything is fine with the baby. If not, they can take next steps.